Hello, everyone, and welcome to our program. My name is Annie, and I'm your facilitator for tonight. And waiting online is Louise Rath, who is a registered nurse, and she'll be taking us through our program today, which is called Preparing for Your Medical Appointment. We would like to acknowledge the traditional custodians of the country that we are located on today. We pay our respects to their elders, past, present, and emerging. We also acknowledge our gratitude that we share this land, our sorrow of the cost of that sharing, and the hope and belief that we can move forward to a place of equity and justice and partnership for all. Okay, I'd like to now do an intro to Louise. So Louise is a multiple sclerosis neuroimmunology nurse consultant, that is a mouthful, at Alfred Health, Melbourne, Victoria. She has over 20 years' experience in public neurology services, including outpatient appointments. Louise is the nurse clinical lead at the Alfred MSNI clinic, which focuses on patient experience, promoting engagement and healthcare, and developing health literacy documents for the service with consumers. So, Louise, I can now see your slide there, and you're ready to go.
Fabulous. Thanks, everyone, for joining us today. It's, always an awkward time to log on at 5:30. So I hope that you're sitting back, and I hope I can give you a few tips today on preparing for your healthcare appointment. So I just wanted to firstly talk about my nursing career. So if I think about the last 20 years, a lot has changed how we turn up to appointments. And I wanted to change the topic today to just not medical appointments, but any healthcare professional appointment that you might go to. Because it might be a GP, it might be a specialist, a physio, a psychologist, or a nurse. So, really try to think about even your dentist, I think, try to work out which healthcare professional you're going to and what you might need and what you might need to prepare for that appointment. So in the last 20 years, I think appointments have gone from being, very simple to very complex today. We know that care used to be very simple, and now you might need lots of long consultations with risk and benefit ratios and what exactly you're wanting from this. And I think when I first started 20 years ago with in MS, a lot of the healthcare appointments were with neurologists who were really letting you know what they thought, and then you left that appointment. But things have changed very much in most healthcare services now. And you'll notice if you look up any major tertiary hospital that you're looking at, policies like patient comes first, it's okay to ask, and shared decision making. So we really, things have changed dramatically, and we're hoping that, webinars like this can really help consumers coming to appointments, just trying to get the most out of the appointment for you. So I've broken it down a little bit as to what you can do before your first appointment, the logistics, when you're in the consultation, and then not everything is leading just back to the consultation, that there's, you can navigate your own healthcare, and I hope I can give you some tips there. What future appointments might look like. So there's lots of different types now. And then what to do if your healthcare appointment is not going how you would like, and when it's not working, and what you can do from that. So hopefully I can get you some nice ideas. So if I think about the planning before you come, I think it's really important to just think why you're at this appointment. Why do you have this appointment, and what you're hoping to get out of this appointment? So we all know that when we go Christmas shopping, we write lists and we prepare, and going shopping, if you don't write a list, you mightn't get what you need and what was important to you, especially if you send someone else. When we go to the taxman or the bank, we really have a file with everything that we might need. So I think a healthcare appointment is no different, that we really want to just have that moment to think about it before you come in and see your healthcare professional. Now, for a simple appointment, it might only be 5 minutes in the car before you come in. But if it's for someone with a chronic disease who has multiple issues that they want to discuss, you might spend the night before just half an hour trying to work out, especially with, your partner or carer or friends, just trying to be really clear what you want out of that appointment and what you need. And this is where, I'm a bit of an organized kind of person. So having a file that you bring in, you may not get it out for every appointment, is just so helpful in navigating what you want to get out of this appointment. So you might write down your questions, knowing that your appointment, you can only get probably one or two of your main top questions, but you certainly want to know what are the two questions that I really want to get out of this appointment. A one page on your history. Sometimes I see people coming to clinic and they have a really thick file and they can't find things and it's not relevant to that appointment. But just having a one page document of your history relevant to this appointment is so helpful. If you've got symptoms, there's so many things that you can download now, looking at what your symptoms are, when they started, what you've done for it, if it's bladder, if it's in headache, if it's a certain symptom that you've got, so helpful to have it written down. So many patients come with not knowing what medication they're on or what dosage, and that just takes out of the time that you've got in the appointment. So important to have this down so that you're not losing any of that precious time with your specialist or whoever you're seeing. So write down your current medication. When I was talking about this today, our admin staff were really surprised at how many people didn't know where they'd had their last blood test or their MRI, even knowing whether it was Dorevitch or Melbourne Pathology or where the MRI was taken is incredibly helpful as well. One of the things that's happened in the last 2 years is how many times I've seen people waste 10 minutes in an appointment, going through their handbag, getting their phone, trying to log on to MyGov, instead of just having the printout of their vaccinations, which would save so much time. We really want you to communicate with your GP, so having that name, and we really want also, pharmacy to send scripts to. So knowing your pharmacist with a fax and email is incredibly important. So I can't emphasize more just to have a file and to have a few minutes before your appointment. What do you need out of that appointment? What are you hoping to get? How can you prioritize, knowing that not everything can be done when you need to prepare more? And I think one of the colleagues from MS Plus said, and I just want to read it, some people want to talk about a problem, others want to hear that it's all going okay, some want to talk about a symptom, others about latest research, and some just need a form completed. So just make sure that you know exactly why you're coming to that appointment. So then I think the logistics are really interesting. So if you're coming especially to a major hospital for an appointment or into a city to see a healthcare professional, you really need to be clear about where it is. And it's often not helpful just to say the Alfred or Royal Melbourne, I'm in Victoria, but just to know where in the hospital is the location of the place that you're going. We also know how stressful it is now to come into hospital, so that already it makes everyone a little bit anxious and a little bit stressed when you have to come through, the COVID screening. It's a little bit disempowering to have the mask still on, to get a sticker on your arm, and then knowing that it's delayed and then not knowing quite where to go. So really think, where's the appointment? Where is the location in the hospital? Or where's the rooms that I have to go? Leave enough time for COVID screening so that you're not stressed. But also think, how are you going to get there? It's incredibly busy around a lot of the city hospitals. So think, is it easier to get an Uber? Is it easier to come on the train? If we all had Shinkansen's from Tokyo, it'd be beautiful. But, how are you going to get to the appointment, and what's the easiest for you? And knowing what kind of time the appointment is. So is this a 10-minute appointment, a 30, a 45 minutes, what I can expect? And, that'll help with the planning as well. And then one of the things that we really notice is how people don't dress appropriately for the appointment. So if you're coming, I know, to an appointment where you might need a blood test, then please wear something that you can roll your sleeve up with. Please think about if you need your blood pressure taken, if you need a neurology examination, coming with tights on and long pants that you can't roll up is taking time to get out of those so that you can be examined, is eating into your appointment. So shoes that are easy to walk in so that they can see how you're walking, and you can slip those shoes on and off. You don't want to lose time for conversation and sharing of information by doing some of the logistic things that if you think before you come in, that would be minimizing the time lost for those things. Don't forget your glasses. I'm surprised how many people forget their glasses coming to an appointment, and then, find it incredibly stressful as to when they're asked to do things, and it just makes it really hard. I think if you're not coming to a public clinic at a hospital, then also ring up and find out how much out of pocket are you going to be? What do you need? What can you claim? So that it's not a shock at the end. So I think really try to think about all these things before you come in so that when you come to clinic, you've arrived early, you're sitting in the waiting room, and you're calm and you're relaxed, and you can focus on, when I go into the room, I want to get what I need out of this appointment. So we all know that everyone's been under a lot of stress, whether it's the client or whether it's the healthcare professional. And I think the wearing of masks has changed the way that we smile at each other and make people relaxed. So even though that you have a mask on when you come to a lot of the consults, you can still smile with your eyes. And I think one of the other things that we're really encouraging is, if you are a little bit stressed, ask if you can bring someone, whether you need a carer or a family member to scribe for you. Make sure they know that they're not going to take over. A lot of our consultations now, the patients are asking if they can record the consult, which at the Alpha we're incredibly happy to do, because we know that sometimes it's really hard to listen when you are stressed, when you've got a mask on. So either getting someone to log in for telehealth or using your phone to tape it, or getting someone to scribe is incredibly helpful. Having your file ready, having your number 1 or 2 questions, that you're all kind of ready to go and to get the most out of this. One of the other things that we notice is we really want people at the end to confirm their plan. We really know that if a doctor says, or a healthcare professional, that we want you to get the MRI next, or I'm changing your medication, ask them to write it down. Don't leave without confirming the plan. When will you be seen next? Have you changed my medication? What tests do I do? When should I come back? So that you know exactly what the plan is, because we know that you're the best keepers of safety, and we really want to encourage that. So download a form off the internet, write your own up, or ask them to write it down so that you know exactly what you're doing at the end. Don't forget at the end of the appointment that if you need a sick certificate, to get it then. Much harder to get it now at the afterwards. Do you need another script? Have that on your list that you need another script. And I had one more thing. And yeah, when the next appointment would be. So if I go back over it again, make sure that you can gather the information that's being said. Have your file ready. Don't tell or say just as you're leaving that number one question that's really been bugging you, because if you had it written down, it would be the first thing you would say. Definitely confirm the plan, and then the logistics of leaving, make sure you get your sick certificate or attendance certificate, and make sure that you get your scripts then and there. Just go to the next one. So we know that there's a lot of future appointments that you can have, and know what's available. So we know that face to face, even though we have got masks on at the hospital, that it is certainly the best way to have an examination and to talk about things and to really look at what we're doing. But you can have telehealth as well if it's just for follow-up. So a lot of our consults will be, I just want in 2 weeks a telehealth appointment so that you don't have to drive in. It's much easier, and that way. So ask about the telehealth. We also know that phone consults, really quick ones that we can still do, although Medicare's making it a little bit more tricky. But make sure that you haven't blocked your no caller ID. So when the doctor is trying to, or the healthcare professional trying to ring you, that it's not blocked. And of course, you can get information by email if you're just wanting results and looking at your, who is in your team, so that you mightn't have to email the healthcare professional you saw, but there might be an admin person or a nurse at the clinic that you can get some information and feedback. So know what other ways, that not everything has to be just that one specific healthcare appointment, but you might be able to, use other people to get what you need as well and to get feedback. So one of the things also that I wanted to talk about is, people rely on just the healthcare appointment, but you can navigate so much more and be so much more engaged in your healthcare. If you register, a lot of the hospitals have portals now, so ask if your healthcare provider has a portal. So our patients can log on, see their appointments, who they're with, and also see some of their results. So, and the letters that have been done, so that they really can engage and become very active in, that appointment's not at the right time. Is there a team that I can contact? Is there a nurse or an admin so that I can communicate back when there's something not right? Sometimes I see people turning up for their appointment when the plan was have an MRI, then see the doctor, but they've been, mixed around and they're coming without that. So ring the admin team and say, I'd like that rescheduled, so that you're really coordinating your own healthcare. Does the healthcare provider that you see have some trusted websites so that you can have a look at some of the websites and get some information that will make you, hopefully give you some insight and help you with some of the questions? And is there some documents that the healthcare providers that can email you or give you that will help you navigate your own care? We use My Health Record a lot at where I work, and it's incredibly helpful to be able to see information. So if you have got it blocked, it would be really helpful to unblock it if you've got a chronic disease, so that everyone can see your latest blood tests, your vaccinations, and if you've been to other services as well. And then I think, with long term, especially if we're looking at chronic diseases, sometimes you might be allocated to a healthcare professional, and not every person can give you everything that you need. So work out, what's the expectation for this healthcare professional? Is it working for me? Can I get other things from other members of their team? But often sometimes you can ask the nurse, and some of our clients say, look, I've tried for a couple of years, it's not working for me. I feel like I can't share information. So, is there a better fit? So always ask, if it's a public clinic, is there a better fit for me that I might be able to navigate to that person? And definitely always think second opinions are okay. And lots of people do that. We do that with our cars, we do that with everything. So really kind of work out when it's not working, and could it be better, and how do I get it to be better, and what kind of relationship do I want with that person? And I think one of the things that I didn't mention previously is also, when you're coming into the consultation, always be incredibly honest with your healthcare and your conversation. So things like continence, depression, self-harm, all things that you might feel a little bit vulnerable telling. It's so much better to be able to have that long-term relationship and share that, and that we've probably heard it before, and that way we can really help. So I think one of the things navigating your healthcare is to really be honest when you're in there and share what's really affecting you, and then what you need out of this appointment. So we know that patients or consumers or clients are the best navigator of safety. If they're looking and engaged in their healthcare and really thinking what they want, then we know that they will be the best keepers of safety. And we know that if you follow up the plan, and make sure you know the plan, that you will be the best person for managing your medication and make sure you're taking it right. And a lot of the MS literature now talks about, an engaged patient and a prepared patient is the blockbuster drug of the next century. So we're really, having this change in healthcare where we really want to partner with patients to really get the best outcome for clients. And when we talk about shared decision making, you might plan for your appointment, but decide that you're happy to give your healthcare provider all the information and be guided by them. That's okay, because they've been given all the information they need and they know what's important to you. Other people will want to discuss more the risks and benefits and be a partner, and that's okay too, because they've planned and sat down before. And so for both sides, planning is definitely the key to getting the best outcome for your appointment. And then I think, I just did these last tips. Know why you have the appointment, know who you are seeing. So it mightn't always be the neurologist, it might be the physiotherapist, the psychologist, the nurse, and you've really got that team. Know where and what time you're coming. Know what you need from this appointment. Try to dress helpfully for the appointment. Know your number 1 or 2 questions. Have your file up to date. You don't have to get it out, but it's like a security blanket. Really know who else is in your team, so that not everything comes back to that one healthcare professional. And I think really importantly, it's not not everything can be solved at one appointment, that it's an ongoing relationship. But I'm hoping that, by thinking and planning and action, you'll get the best outcome for whatever healthcare appointment you go to, and that you will be in control and hopefully not as stressful. So I think that's for me.
To access our programs or any of our services, we invite you to contact Plus Connect, and that is free call 1800 042 138. Or if you'd like to email us at connect@msplus.org.au, you're welcome to do so. And that is the gateway to all of our services. They'll be able to give you a referral to the other programs that I mentioned earlier. So please feel free to contact the lovely people on that line, and you'll always be greeted with a smiling face and a friendly voice. Thank you, everyone, for joining us. All the best. Bye for now.